Now we are going to quickly go through the types of most common arthritis that we come across, and we are going to look at uh, the classical joint involvement in each case, and also the classically spared joints in several particular cases. So starting from osteoarthritis, so classically you can see these are the joints that are involved. So starting from cervical and lumbosacral spine in the vertebra, and it also involves the proximal interphalangeal joint and distal interphalangeal joint as well. This is very very important because it rules out from rheumatoid arthritis where the distal interphalangeal joint is involved. And in osteoarthritis, after PIP DIP, the first carpal metacarpal joint also, carpal metacarpal joint also involved. That means first means your thumb, and next the hip joint, the knee joint, and also the first metatarsophalangeal joint is also involved. And the joints that are commonly spared, you can see here, starting from elbow, wrist, ankle, and MCP. So the MCP is spared. So when we come to rheumatoid arthritis, the commonly involved joints are shoulder, wrist, MCP, PIP, knee, and MTP. MCP mean metacarpophalangeal joint, PIP mean proximal interphalangeal joint, and knee MTP. And classically, you can see, as we discussed earlier, the DIP, distal interphalangeal joints, are spared classically in rheumatoid arthritis. Okay, so now the next type of arthritis is ankylosing spondylitis. And so you can see classically the patients present with back pain. So you can see sacroiliac joint, involvement of sacroiliac joint classically, and there could be the involvement of intervertebral joints as well. And we don't really talk about specific type of sparing in this type of arthritis. And lastly, we'll talk about psoriatic arthritis, which we can see the involvement of PIP and DIP, and we call this pattern as ray distribution. So ray distribution is seen in psoriatic arthritis, which means like the joints that present distally, PIP, DIP, NCP, all MCP, all these joints are involved in psoriatic arthritis. And there's no classical sparing of distal joints like we see in osteoarthritis and rheumatoid arthritis. So it distributes like a ray. All the distal joints in the hands are involved. So that's what ray distribution is called. So yeah, it's just a quick summary to compare the main types of arthritis which will be useful in coming to diagnosis in clinical cases.